understand their signs and symptoms and the problem that they suffer, and be able to follow some sort of exercise and home-based routine for quicker recovery. If you write for me any question, I will definitely answer that question. You can check my channel. All of the question has been answered. None of the question will be left without any answer. If I don't know something, I will tell you to maybe seek help from somebody else. Don't forget to subscribe, like, and share this channel for weekly updates. Let's get started. Spondylolisthesis is a result of advanced degenerative disc diseases. It's a condition that discs degenerate and resulting in loss of disc height. This condition causing instability in one vertebra to slip forward over another one below it. Other cause of spondylolisthesis would be stress fracture or congenital abnormalities. There are some rare causes such as tumor and trauma. Degenerative spondylolisthesis is a consequence of aging process in which the bone, joints, and the ligaments in the spine grow weakened and become less able to maintain the alignment of the spine. This type of spondylolisthesis typically occur at one of two levels of lumbar spine, L3, L4, or L4, L5, which is the most common one. Degenerative spondylolisthesis is more common in people over age of 50, and in particular among individuals over age 65. Women are 2 to 3 times as likely as men to be diagnosed. Spondylolisthesis can cause impingement of the nerve and fatigue of the back muscles, and may result in lower back and leg pain. The symptoms of spondylolisthesis may be lower back and leg pain, sciatica, and aching pain in the hip, buttocks, and lower back that radiate into the back of the thighs and the legs, a shuffling gait when walking, or weakness in the lower extremity, or abnormal posture. If you experience any of these symptoms, we would recommend you to visit your physical therapist and ask them for advice. After correct diagnosis of spondylolisthesis, your physical therapist will recommend you a treatment plan which is included physical therapy and strengthening exercises. You may rest and restrict certain type of activity to minimize your pain in that period of time. Injection sometimes would help with reduce the pain and swelling, and you may take some medication and analgesic to reduce pain and swelling. The first exercise that I'm going to show you guys, we're trying to improve the mobility in our lumbar spine, which we call the posterior tilt of your pelvis. I'm going to show you how to do it. You can give it a try. You're going to lie on your back. You can use a pillow if that feels more comfortable. We're trying to push our spine down to the ground, which means with that movement, it creates a posterior tilt in our spine and our head. I'm going to put my hands underneath of my lower back to just feel that pressure from my lower back. If you feel this is uncomfortable initially, you got to be patient, breathe in and out while you're doing it, and you're trying to slowly create that movement. I'm trying to hold it for 5 seconds, 4, 3, 2, and relax. We're going to try it one more round. Push it down. You can feel the pressure from my lower back. 4, 3, 2, 1, and relax. When you repeat this movement, it actually creates more strength, and you can actually use those muscles better than where you started. You're going to practice this exercise for 3 sets of 5, and you hold it for 5 seconds. Now, from there, we're going to progress this exercise. I'm going to show you the second move, which is we're going to do something similar to dead bug, but it basically we're trying to hold our posterior tilt and create those movements. We're going to practice this, which means we're going to push the pelvis down posteriorly, hold it there, and we're trying to bring one foot up, slow down, back up again, slow down. Now, the most important part of this exercise is that when you're doing this movement with your leg, you want to keep your lower back pushed down to the ground and maintain that stability. I'm going to show you one more round. Hold my hands there just for you to understand what we're doing. You push it down, bring one leg up, slow down. While I'm doing this movement, I'm trying to keep my hip, my pelvis down to the ground, not moving. 4, and I go one more, and 5. Now, when I got more comfortable with this exercise, I try the same thing, posterior tilt, my pelvis, hold it there. I bring my arms as well, back and forward, back and forward. While I'm doing this exercise, guys, my pelvis doesn't shift, up, slow control, and back. Now, you can switch side. You gotta practice this exercise for a while to get better in it. And you will be surprised, it takes time to actually get to that level. Posterior tilt, bring the legs up, slow down, back up. You go for 5 tap. You gotta make sure that you're breathing while you're doing this movement. And I'm gonna show you the progression. You know, foot up and arms at the same times. Back up and relax. Now, you're gonna try these exercises for 3 sets of 5. Tap it, slow and controlled. Don't rush it for the progression for both arms and legs. Be patient, practice slow, step by step, breathe in and out, and make sure to not rushing it. Let's move to the next exercise. The next move that I'm going to show you guys is going to be hip bridges or glute bridges. There's so many different ways to call it, but I'm going to show you the version that's suitable for you, and you can practice that. We already learned how to posterior tilt our pelvis, and we're going to try a similar movement while we're doing our hip bridges, which means we're trying to posterior tilt your pelvis and then go for hip bridge. Posterior tilt the pelvis, hold that, and go for hip bridge. Posterior tilt pelvis, and we're gonna go up. Slow control down, tilt pelvis, and go up. You can hold it at the top for a second, slow down. You can hold the hands on the ground if you feel more comfortable. Back down, and hold it there for 1 second. We're gonna go one more round. Posterior tilt the pelvis, hold it there, and we're gonna go for a bridge. You do feel that your glute and your hamstring could actually work while you're doing this exercise. You know, posterior tilt the pelvis and back up again. Hold it there for 1 second, slow control down. It's a very gentle move, guys. It's not very quick. You want to start with 3 sets of, let's say, 8 to 10. Slowly progress them to 15 repetitions. Your movement is slow tempo, which means you're trying to create movement of your pelvis initially and push it to the top and hold it there for a second. Make sure that your glutes and your hamstrings are working, and slowly you're coming down. Progress them step by step and challenge and see which muscle works. Your glute and hamstring usually will be the primary muscle. One of the main areas that feels very stiff and immobile would be around your hip and your lower back. I'm going to show you a very simple stretch that you're going to do in a daily basis while you're doing these exercises. As you can see, part of this routine is not necessarily stretch only, it's a mobility, strengthening, and stretches at the same time. And I would always suggest my patient to do all of them at the same time. Don't stick to only stretching certain muscle group, because stretching is great, but it doesn't necessarily strengthen that specific muscle. I'm going to show you how to stretch your hip very gently without aggravating your pain. This is the safest position for you to do. Basically, you're going to lie on your back, and you can use your both arms and hold your knee down to your chest. Now, while you're doing this, it creates some sort of like posterior tilt for your hip anyway, which is great That's what we're usually looking for. But if you have issue to holding both knees, you can start initially with one knee, and if you find your knees are sore to hold it from there, you can hold them from underneath of your basically knee, hold it there 15 to 20 seconds. Our aim is to get to 30 seconds hold. You're breathing in and out, and you can hold one leg, and then if you whenever you felt comfortable, you can bring both legs, hold them there, and if you can hug the knee, it would be definitely more stretch on the hip, and you can feel it more. You're gonna hold it there for 30 seconds, and you can try this for 3 set to 4 set every day. Now, I'm gonna show you, if you find this stretch is very easy, you can even bring the knee kind of like hip off the ground, which means you're bringing it a little bit higher, and that creates a bit of more posterior tilt on the pelvis and your lower back. This is one of the simple stretches that you can do while you're doing these exercises. Try it for 3 to 4 sets of holding it for 30 seconds. If you find it uncomfortable, start with one knee and slowly build it up to holding both knees. Make sure you're breathing through the exercises and not holding your breath. The last exercise I'm going to show you today, guys, it's a very simple stretch for your hamstring. Hamstring is another muscle that you can actually stretch while you're experiencing this condition. It's a very simple exercise. You may need a towel or a belt or those stretch pulls. You can use anything. Towels is straightforward. I'm going to show you how to do it. You can lie on your back and wrap that kind of like around your foot. And what we're trying to do, we're trying to create that movement.
Are you a Maryland renter at risk of being evicted due to COVID-19 related issues? Help is on the way with Maryland's Emergency Rental Assistance Program. You may be eligible for assistance in helping to pay current
while we're doing it, which means you're going to go down and come back up, slow down and come back up. You might not be comfortable to go all the way up initially, but what we're trying to do, we're trying to create that movement. Hold it there for 5 to 10 seconds, slow back down and back up again. If you find that you're feeling the stretch in some specific position, hold it there for 10, 20 seconds, progress it to 30 seconds. It feels very comfortable. I'm not feeling a strong pull. And slowly, if you find it more comfortable, you can actually bring it a little bit higher. You're going to practice the same thing on the other leg. You might find one side is a little bit more tighter than the other side. Bring it up. Breathe in and out. Slow. Feels very good. I can feel my hamstring. Definitely feeling the stretch. Even up to here. I don't need to force it and bring it a little bit hard. This towel, it's great because it gives you kind of like control on your stretch without pulling too much or too little. You're gonna hold it there for 10, 15 seconds. Slowly progress it to 20 to 30 seconds hold. Try it for 3 sets to 4 sets in each side. With following this routine, you don't necessarily need to follow the exercises back to back. You can do it in your own way, but make sure to try this exercise at least once a day. For optimum result, I always tell my patient to try them twice a day if you have time, when you wake up in the morning or before you go to bed. I hope you find this video helpful. If you have any question, make sure to leave me comments and I'll get back to you quickly. I'm going to repeat this again one more time, that I'm going to give 1% a free online consultation every week. And you can simply, with entering a message or a comment on this video, liking this video and following us on our social media or Facebook and Instagram, be that winner. I would like to thank you for watching this video and following us on our social media and YouTube channel. Your support means a lot, and I'm looking forward to see you all in the next week. All the best.
Every movement is all about rotation. Our bodies evolved to rotate through infinite planes of motion, and the majority of the muscles and joints in our upper body are structured for rotation.
All right, hi, welcome everyone. Thank you for joining me. My name is Yoav Suprun, physical therapist. I started my career in New York City in 1995 after serving in the Israeli Air Force for 4 years. Moved to New York and started my career as a personal trainer. Anyone knows how long it might have taken me to become a trainer in America in 1995? I read a book, I memorized it, passed the test, and I was a certified personal trainer. And got a bunch of clients in a gym in New York City, and unfortunately I injured a bunch of them. Not intentionally, didn't know that some of the stretches or some of the exercises I'm doing with them were actually not appropriate for them. I read a bunch of books, read some magazines, thought I knew how to train people, but unfortunately I would get once in a while a phone call. After what we did, now my back pain is actually acting up and I'm feeling it down my leg. At times I would get a phone call, I'm sitting on my sofa and it's very hard for me to get up. Or times where I would hear I'm trying to turn my neck after a workout and I can't turn my neck. And I stretched those clients when they were in pain. As a trainer, that's what I thought would be appropriate. When you are in pain, we tend to stretch. Lower back pain and sciatica is now a culprit. It's a problem across the world, not only in the United States. We are seeing more and more people coming to our clinics complaining of back pain as well as sciatica. Sciatica is nerve pain that starts in the back, but you actually feel it down the leg. It feels as if you need to stretch that. It feels as if you need to do something to alleviate your leg symptoms, but actually the pain is not from your leg. Most of the time it's coming from your spine. So I operate 2 clinics in Miami Beach, and I see people who have been through traditional physical therapy, chiropractic, they may have had injections, they may have had MRIs, they were told all kinds of things on their back. And often we find that about 75% of the patients that we see, within a couple of sessions, if you find the right direction and the right exercise for that person, within a couple of sessions that person can fix themselves, he or she can get full resolution of their problem. Not only that, they can prevent it from happening again. Okay, so we're going to talk about some of the misconceptions about lower back pain and sciatica. 10% of this country right now either have back pain or sciatica. 1/2 of all working individuals admit to having lower back pain every year. It used to be the second most common reason to see the doctor. Now it became the primary reason. And we have heard many things in the past 20 years what one should do. For example, we heard you should strengthen your core. So a lot of people did core strength. A lot of people joined all kind of Pilates and yoga classes hoping to strengthen their core. We see a spike of back pain and sciatica with people that try to strengthen their core. You can be chiseled, ripped, 6-pack. If you don't know how to sit, your core doesn't hold you here. There is not an exercise for the core that will hold you up here. Not one that exists in the world. You have to know how to sit in order for your spine to be in the right alignment. If you are very strong and you strengthen your core for months or even years, and you hired a trainer, you took a class to strengthen your core, but you sit like so in front of the computer or you slouch on your sofa, eventually you may develop back pain or sciatica. What does it mean most back pain cases are mechanical? Mechanical means something moves out of place. There's days that it's in place, and those days you walk, you feel fine, you drive, your leg doesn't bother you. And the days where it moves in the wrong direction, all of a sudden it's hard for you to bend, it's hard for you to get dressed, you're walking and your leg feels funny after sitting, You may be lying in bed and all of a sudden your leg starts talking to you and you flip to the other side and the pain goes away. It comes and goes. It moves. Mechanical means something moves in your back. It's not as a result, often, it's not a result of arthritic changes. It's not as a result of getting old. It's not as a result of having a weak core. It's a result of something that moves. And on days that it moves in the wrong direction, it radiates down your leg. On the days that it's in place, you feel fine. We spend a lot of money each year, and we can get this country out of debt if we know how to prevent back pain. If the public knows how to prevent back pain, that's my hope in seeing you, is to teach you how to evaluate and treat it on your own. To know what it means when your back is about to go out, we can save this country a lot of money. Experts estimate that as much as 80% of the public will experience back pain at some point in their life. So let's take a look at the spine. We have the spine right here. So this is the spine. You're looking at yourself now from behind. This is your right buttock, this is your left buttock. When you look at the spine from a profile, you see there are certain curvatures in the spine. It looks like an S. The spine, as we age, loses that S curvature often and it becomes more of a C. Hence, you see a lot of people, as they age, are actually a little stuck here. Whether it's towards the cane or towards the walker, or they walk holding themselves in this position. They used to be here, and now the largest generation in the history of the United States started to retire a couple of years ago. They are called the baby boomers. And they're all saying, listen, I've strengthened my core, I worked out, I opened my chest, and I'm still feeling that I'm not standing the way I used to stand. Look at mom, dad, grandma, grandpa. A lot of the people we know are ending up in this direction. Something occurs in the lower back over a lifetime that prevents the lower back to stay hollowed. We are interested in keeping this. If you can keep this lower back hollowed throughout your day, there's a very good chance you will not experience back pain or sciatica. So where can the pain come from? Could be many regions. It could come from the vertebrae. It can come from the ligaments around your back. It can come from the disc. It can come from the nerve. Research shows it's very hard to pinpoint exactly what structure is the one that's causing you pain. Some of you have heard you have a herniated disc, or you may have osteoporosis and your bones are not as firm as they used to be. You can see here, this is a normal vertebrae, this is an osteoporotic vertebrae. It's more spongy, more brittle. Causes of pain can come from many regions. However, some of you told me before, when we were talking outside, you got an MRI and you have stenosis, or you have herniated discs. But at the same time, when I asked you, do you have good and bad days, you said, all of you said, yeah, there's days where it's there and days where it's not there. So what happens to your stenosis or your herniated discs on the good days? How come there's weeks where you feel fine and weeks where you're hurting? This is an interesting phenomenon, and it relates to the movement of the spine. There's a wide distribution of nerves all around the spine. Starting around the early 90s, some top researchers around the world have concluded that, and Kuzlich et al. In 1991 published an interesting study, the predominant, not the only, but the predominant source of back pain was the intervertebral disc. And some of you had MRIs and you're aware of it, that it's coming from the disc. And the source of sciatica, this is the sciatic nerve, the source of sciatica is a compressed nerve root, something that chokes the nerve, and when the nerve gets choked in your back, you feel it down into the leg. One lady in the back said to me, it's my scoliosis. I was told it's my scoliosis, and I asked her, do you have good and bad day? And you said, yes, there's days that my back doesn't hurt. There's weeks that I feel fine. How can your scoliosis be the cause of the problem if you have weeks where it doesn't bother you? The scoliosis is still there. So when I graduated at NYU, after injuring enough people as a trainer, and obviously I'm exaggerating, but there was a bunch of people I couldn't fix, didn't know what to do with them. I decided to go to NYU and did my doctorate in physical therapy, got great education there, and went to study afterwards with this gentleman. His name is Robin McKenzie. McKenzie unfortunately passed away 2 years ago. He lived his life in New Zealand, and in 1956 he discovered a very interesting phenomenon. The patient, he called him Mr. Smith, came into his office limping. He walks in with severe right leg pain. And Robin says to Mr. Smith, Mr. Smith, why are you walking like this? And Mr. Smith said, I had back pain, on and off, intermittent, for weeks. However, 3 weeks ago, sorry, for years, but 3 weeks ago, I lifted something heavy and all of a sudden the back pain became leg pain. And now my leg is hurting and I'm not feeling steady when I walk. So Mackenzie says to Mrs. Smith, please go to that room over there and lie on the stomach. I'll be right there. I'm going to examine you. Take your shirt off, lie on the stomach. What Mackenzie didn't know is in that room, the bed was left elevated. His assistant did not take that piece of wood down, so Mr. Smith goes and lies in a position called extension. Mackenzie walks into the room, he finishes up with another patient, he walks into the room and he sees the patient lies down, bent backwards. That was considered the worst thing you can do for someone that has back pain. And he looks at Mr. Smith and he's like, Mr. Smith, how are you feeling? He says to him, my leg pain is gone. What do you mean it's gone? It's gone, get up. He gets up. Not in my leg. The pain moved out of my leg back to where it used to be in the center of my back. So Mackenzie was very intrigued by that phenomenon. How can the pain move? What we know right now, and what research is supporting, and you are welcome to look at it online. Google the phenomenon of centralization of back pain. Every neurosurgeon knows about it. If you have back pain that becomes leg pain, you are getting progressively worse. If you have leg pain that becomes back pain, you're getting better. Meaning, if you came to take a class, Zumba class, Pilates class, yoga class, P90X, TRX, spinning, whatever it is, and you started the class with leg pain, and you left the class and now your back is hurting, you are actually moving in the right direction for your back. Something is moving your back in the right direction. The opposite is also true. You started a class or you did an activity and it was hurting your back when you are beginning that class. And now 45 minutes or an hour at the end of the class, your back feels fine, but your leg feels funny when you're driving home. That class may have injured you. And that's something we're trying to instill to the American public, which is a very important phenomenon I did not know as a trainer. Location of pain, where it should hurt, is paramount. Do not fear pain. When I see you individually in the clinic after this talk, I'm going to move you around to see if I can change your pain location. If we can get the pain out of your leg into the back, it is heavily documented to be a good thing and you have a good prognosis. You actually can get better. And the goal in the assessment after we meet is to try to see if we can change your pain and we can change your mechanics. And I'll talk about mechanics in a little bit. Should you go get an MRI if you have back pain? And we now know that after all those years of people having MRIs, we have a group in Tallahassee, Florida that convinced Blue Cross Blue Shield to look at it. Blue Cross Blue Shield of Tallahassee, Florida. Dr. Nancy Van Vessen, the Chief Medical Officer of Blue Cross Blue Shield in Tallahassee, Florida, over time saw an interesting phenomenon, an interesting change. 65 out of 100 adults without any back pain have abnormalities such as arthritis and bulging discs. Meaning, if you take 1,000 people right now, over the age of 65, you throw them into an MRI machine, you will probably get major changes in their back and they may not be symptomatic. Meaning, the patient does not have pain, although the MRI may show that they have major changes, such as arthritic changes, bulging disc, herniated disc, facet arthrosis, whatever it is. But that person may not have pain. Which means these images make early clinical correlation problematic and can lead to inaccurate association between chronic asymptomatic findings and acute pain. Just because it's on an MRI doesn't mean that you have to be in pain. So for us to understand you, we need to move you to see if we can change your pain. Unless there's a serious symptoms, uncontrolled bowel and bladder, these imaging studies are not recommended unless after a couple of weeks, up to 6 weeks, the pain is still severe and not improving. The older you are, the greater the chances that your back x-rays or MRIs will show that you have something there that may not be the reason to your pain. The take-home message, ladies and gentlemen, is you do not want to go under any procedures, x-rays, MRIs, medication, injection, or surgery, for sure not surgery, unless you saw a mechanical therapist that can move you around. We as McKenzie or MDT therapists, mechanical diagnosis and therapy, that's what we do when we see you. I listen to your history, I move you around to try to see if we can get your pain out of your leg into your back and abolish it from your back. The pain should recede back and disappear from your back. Research have shown that the McKenzie procedures for assessing patients with low back pain was found to be more accurate than an MRI in differentiating discogenic or non-discogenic pain, as well as contained from non-contained disc. What does it mean, contained versus non-contained disc? Here we have the model of two vertebrae and a disc between them. This is the spinal cord, these are the nerve roots. When someone has a bulging disc, the disc starts to move towards the nerve. It starts with back pain, and often it moves onto the nerve, and the further it squeezes or chokes the nerve, the further down the leg you will feel your symptoms. As the pain moves back up, often we find that that bulge actually is receding back towards the center. That was McKenzie's model, the hypothesis that he developed in the 50s. Something must have moved when Mr. Smith lay there in extension and the pain came out of his leg back into the back. A contained disc means this is still intact. A herniated disc means this jelly that's in the disc has squirted out. When it squirts out, often people start to have severe neurological, that's what a herniated disc is, severe neurological symptoms down below their knee. You may have a foot drop, you may have difficulty walking, severe burning sensation, whether it's in the neck,